Welcome to BanishCancer channel. I'm your guide, Sarah. Today we're tackling a question that sparks a lot of worry. Can surgical scars lead to cancer? It's a concern many people have after surgery, and in 2025, science has some clear answers, along with a few important cautions. Let's start with the good news. Most surgical scars do not become cancer. Large studies show the risk is very low. The scar you see on your skin is usually just a mark of healing, not a sign of danger. But there are exceptions, and understanding them can help you stay safe. One of the biggest exceptions is burn scars. Research shows that burn wounds, especially those that don't heal properly, can sometimes change into cancer. Doctors still don't fully understand why, but chronic inflammation seems to play a major role. That's why burn scars should always be monitored closely for changes. Another type to watch is keloid scars. These are thick, raised scars that grow beyond the original wound. Studies suggest people with keloids may have a slightly higher risk of certain cancers, including skin and even pancreatic cancer in women. Not every keloid is dangerous, but if you have them, it's smart to keep an eye on them and talk with your doctor about any changes. Now here's where the science gets fascinating. Researchers talk about two kinds of scars: physical scars and DNA scars. Physical scars are the ones you see on your skin after surgery, a cut, or a burn. DNA scars, on the other hand, are tiny marks left inside your cells when your body repairs damaged DNA. Most of the time, DNA repair works well, but sometimes mistakes leave behind what scientists call mutational footprints. These DNA scars can influence how cancer develops and how tumors resist treatment. In fact, scientists are now mapping what they call the human repairome, a catalog of all the DNA repair marks in our cells. By studying these patterns, doctors hope to design more personalized cancer treatments and even predict who might be at higher risk. So, what does this mean for you? It means that while the scar on your skin is usually harmless, the story inside your DNA is more complex, and it's one reason why cancer research is moving toward personalized medicine. Let's talk about chronic inflammation. When a wound doesn't heal properly, inflammation can linger. This creates an environment where cancer cells can grow more easily. Think of it as a wound that never fully closes. The tissue around it becomes a breeding ground for problems. That's why proper wound care is so important. Keeping scars clean, moisturized, and protected from infection reduces the risk of long-term inflammation. There are also tumor microenvironment changes linked to scarring. Scar tissue can thicken the area around a tumor, making it harder for immune cells to reach and fight cancer. This is especially true in aggressive cancers like glioblastoma, where tumors often recur in scarred brain tissue. Now, let's clear up a common myth. Not all scars become cancerous. In fact, only a tiny fraction ever do. For example, only about 2% of squamous cell carcinoma cases start in burn scars, and just 0.03% of basal cell carcinoma cases come from burn scars. The vast majority of scars heal without any problems. Still, vigilance matters. Here are some practical tips. Check your scars monthly in good light, using a mirror if needed. Look for changes in color, size, or texture. Watch for new bumps, ulcers, or sores that don't heal. Pay attention to itching, pain, or bleeding. Take photos to track changes over time. If you notice a scar that darkens, thickens, bleeds, or becomes painful, don't wait. See your doctor. Early detection makes a huge difference in treatment outcomes. Good wound care also lowers risk. Keep incisions covered while healing, use doctor-recommended ointments or silicone sheets, and protect scars from the sun. If you've had breast surgery, follow-up imaging like mammograms or MRIs is essential. And if you have a family history of keloids or genetic mutations like BRCA1 or BRCA2, your doctor may recommend closer monitoring. Looking ahead, research is moving fast. Scientists are exploring how scar tissue interacts with cancer cells, how to target fibrotic scarring in brain tumors, and how to use molecular profiling to design therapies tailored to each patient. Artificial intelligence is even being tested to help doctors spot scar changes earlier and more accurately. So, what's the bottom line? Most surgical scars are safe. Burn scars and keloids deserve closer attention, and chronic inflammation is the real enemy. The scars inside your DNA, the mutational footprints, may hold the biggest clues for future cancer treatments. Stay proactive, care for your scars, check them regularly, and talk to your doctor about any changes. Science is clear: scars rarely lead to cancer, but awareness and early action can make all the difference. Thank you for joining me on the BanishCancer channel. I'm Sarah, and I'll see you next time as we continue to bring clarity, compassion, and knowledge to the cancer journey.